Not a big fan of blood? Not this guy. But possibly a fan of chemistry? Then you might find a good career in pharmacy, or a pharmacy technician might be the right choice for you. Let's go inside and find out what these wonderful professionals do day in and day out.
Pharmacy is really important for a lot of different reasons in a hospital. They really do serve everywhere that we give medications to patients. Everywhere we give a medication, they are all going through that process of making sure that it's the right medication and it's safe for the patient. So the 22,000 ER visits a year, the 6,000 admissions that we have on the inpatient side, the pain center where we're giving medications, the cancer center, the infusion center, so they have a special technique and process for checking chemotherapy. There's just a really wide amount of responsibility for pharmacy in a hospital operation.
Well, a pharmacist has to make sure that we have the right drug at the right dose, at the right route, at the right administration, make sure they're getting it at the right time. In a hospital, pharmacy, unlike most other service lines in the hospital, we touch every aspect of the patient. If a patient comes in to get a CAT scan, I have to make sure that that technologist down there has contrast dye, otherwise they can't perform their job. I have to make sure that if they're getting an operation, that the nurse anesthetist or the anesthesiologist has the appropriate medications readily available to them to where they can administer them. We have a shortage of medication. I have to make sure that I'm finding alternatives so the patient can get access to something at least of equivalency to where they can be treated. And so there's a lot of different things that we have to do here in pharmacy.
Very rough overview of us. We really are just in here, verifying medications, making sure patients are getting correct therapies, whether that's antibiotics, pain medications, stuff like that. Double checking doctors, call and verify information with doctors. It's a lot of, collaboration between us, nurses and physicians, but just a lot of problem solving, I'd say, is probably like the best way to put it. But when it comes down to it, we're just verifying medications, checking stuff like that.
Pharmacist is basically the last line of defense before you receive a medication. We're doing a lot behind the scenes, checking for those drug interactions, condition interactions. It requires sometimes more time than you would expect. It's not just slap a label on it. Pharmacy touches every department in the hospital. Everybody that has any kind of medication in them is under regulations from pharmacy. Everybody is a customer. The doctors, the nurses, the patients, everybody's a customer.
If I am trusting the pharmacy as the double checker safety net for patients getting the right medications, they need to be detail oriented. They need to have structured thoughts and processes in order to do the job that we're depending on them to do.
As far as school goes, pretty heavy on the chemistry. All of your sciences are good because you also have to take classes in physiology, and you learn a lot about a lot of the biologies. You still need those because you're learning how the meds work in the body. But it's very, very heavy on the chemistry.
I was not always the best English student, all the writing and stuff like that. That wasn't for me. I was more of, math, biology, chemistry. Those were my three things that I loved in high school, and they came easy to me. Good focus on mathematics will take you a long way in pharmacy for sure. Chemistry is also really going to help, but I would say, we do math every day.
The higher maths you will use, but not as much. A lot of the math is actually pretty simple. My pharmacy calculations teacher told us it was the hardest fourth grade math we'd ever do.
Best thing that a lot of our team members have is they try to communicate the best they can. A lot of them are very detail-oriented, which is fantastic. I'd say we all have really good people with a lot of good work ethic, and that's really important. They tend to do above and beyond what they're asked, and I think that really helps the pharmacy flow as well as it does.
Pharmacists are highly trained and they're very intelligent, and we all depend on them to use that analytical brain, but but then we're also in a people business, so.
You want somebody that communicates well, that has caring and compassion towards patients. People get frustrated with things that they don't know why, and they call and they're frustrated, and you have to be able to talk to them and try to not make them more frustrated.
I have to make sure that we are transcribing all of their home medication lists appropriately, because there's certain things we have to hold because it could actually bring them harm, given if they have pneumonia or if they have some sort of heart condition. Some of their medications can be causing the issues, and we have to hold them temporarily.
If you've got a patient that goes to 3 different pharmacies, well, we may only have one pharmacy's notes, so then we got to go through and look and see, you know, what are they actually on, what's their current dose. It's just stuff like that, which I'd say is like a problem we face daily, but I mean, it's nothing our team can't handle, you know.
You do have to be friendly because this is a people business, so you do have to be flexible enough and friendly enough to work in an environment where the expectation is that you're nice to people. So that's just a basic expectation. We hire nice people.
I really enjoy the people that I work with, and that helps a lot.
My husband in 2010 was diagnosed with cancer, and through his course of his treatments, he had some life-threatening complications, and it was the pharmacist that was crucial in saving his life. My husband is very well today, but because of the pharmacist being able to step in, I knew that pharmacy was more than people just counting your pills and you picking it up at a window to take it home. There's lots of different things that this profession does.
It always kind of just fascinated me that, you know, you can take something by mouth, or, you know, a small amount of drug goes into an IV and it fixes something. So that always just kind of fascinated me. I also, you know, had a grandmother that was she had a lot of like conditions and stuff like that, and I'll never forget, like, our small local pharmacist really took the time and helped her out a lot, and it really just showed me, you know, pharmacists can be important in like the clinical world. So that kind of helped boost me, like, you know what, this seems like something I could really see myself doing for the rest of my life, and just kind of fell as it fell, and here I am.
There are different pathways. You can do fellowships. You can do something with one of the governing bodies, like the Board of Pharmacy. You can find something to maximize your skill. There are nuclear pharmacists. You need people with specialized training and qualifications, and that's very focused field. You have oncology pharmacists, you have ICU pharmacists, you have emergency medicine pharmacists, cardiology pharmacists. There's a lot of different trajectories, and not only with pharmacists, but with pharmacy technicians. Technicians can become very specialized. They just are not required to do the same university education.
A lot of the things that make a good pharmacist make a good tech. I've worked with techs that went on to pharmacy school later.
As soon as you can, I think it's important to get a job that mimics the same set of skills that you think you might be going for, so that you can see, oh, I like the camaraderie and the team and the relationship with patients and how the flow of my day goes. And so I think that that's a really important step, because the baseline is we expect everybody to have the right knowledge, but you have to love what you do in order to really stay motivated in healthcare.
I feel like when I'm done here with my shift, I go home knowing that, you know, like, I impacted patients' care today. And you're like, I think I helped somebody out, you know, even if it's the nurse or doctor has a question for us and asking us about, you know, what do you think is the best option on this drug for this person? And that's really kind of just like, wow, that's awesome. I'm a valued member. They want me in this part of this team. They think that I can help benefit this patient, you know. It's just kind of cool.
And joining us live from Western Missouri Medical Center is Jeannie Figueras, Pharmacy Director, and her staff. Jeannie, Sammy, welcome.
Hi. Hi. Nice to be here with you guys.
Welcome to Healthcare Career Day. Why don't you go ahead and just kind of give us an overview of what you do, and we got some questions coming in right now.
Will do. Well, my name's Jeannie Figueras, and I'm the Director of Pharmacy here at Western Missouri Medical Center. And just want to give you a little trajectory of how I got to pharmacy. I didn't start out from high school immediately thinking that this was my career. I started out as a voice theater major, and I thought I would be on Broadway. And then when I knew I wouldn't be on Broadway, I went ahead and decided to do something different. And so I actually went to dental hygiene school. So I was a dental hygienist. And then, like I said in the film, my husband had some life-threatening complications with cancer. And because of the pharmacist knowing his disease state, knowing the medicines he was on, knowing his labs, stepped in and helped save his life. And so that's when I started my pathway into pharmacy. And so with this profession, what you saw in the film is you're seeing a lot of the operations behind. You saw people getting medications, seeing people check those medications, talk about what we do on an operational level. But we also do things on a clinical level, as far as I know if somebody comes in if they're having a heart attack, I know how the medicine that we need to give them, how the body breaks it down, how what the reaction it is to the body in order for them to have the best outcome. Additionally, pharmacy technicians, you saw them in the video that they were doing some of just the day. There's a lot of operations that have to happen. However, with pharmacy technicians, they are specialized as well. They can go to pharmacy technician school, which is just more like a tech program. You don't require the same university education. However, they are crucial to how we get things done. They assist us in actually compounding the medications that you see in the bags there. Those medicines, those are made by somebody, and we have to make those, and they are crucial in that part. So they have to be equally as detailed as we are, because they are our second. They are also a fail-safe for us as well. Hopefully that gives just a little short overview of what I do, but I'm happy to go further into some of the other fields of pharmacy. We have, again, oncology pharmacists, other clinical pharmacists as far as emergency room. You can work in industrial pharmacy where you're creating the pharmaceuticals. A pharmacy technician can work, going on the pharmacy technician side, they can go into helping manage controlled substances where they are doing audits. They are helping legislative bodies like the Board of Pharmacy to make sure that we are following all the rules and regulations the same way as pharmacists are.
You know, great point on the API, or the advanced pharmaceutical ingredient component. There are a lot of companies in the state of Missouri that actually build the ingredients for the drugs that we take day in and day out. Pfizer's located here, Mallinckrodt, Catalent Pharma, and so many others. That Missouri is actually a leader in the advanced pharmaceutical ingredient space. So great that you mentioned it. We have some great questions coming in. We have one young man, I believe, or a young lady. Taylor G is wanting to come in from Lamar High School, ask a question live. Taylor, are you in the Zoom? Okay. Taylor's coming in now. If you want to go ahead and ask your question, Taylor.
How busy is it normally on a scale of 1 through 10?
How busy is it in the hospital pharmacy?
Yeah.
On a scale of 1 to 10, it's a 10.
I have one more question.
Go ahead, Taylor.
How do you sort your medicines?
Well, our system, there's several different systems of sorting. Part of it is that we have to keep track of inventory because these medicines are expensive. For instance, one vial of a medication called Rituxan costs $9,000. And so if we have a medication where a patient has to actually receive 2 of these vials, that's $18,000 right there. So we have to make sure that we're handling these things appropriately. We also have to handle many hazardous medications. So we have to wear certain gloves, gowns, because we are handling things that could cause harm, and we do not want to bring harm to ourselves. A lot of people don't think that pharmacists pharmacists or pharmacy technicians roll into this type of action. But when we are sorting out these medications, we are making sure that we look at, one, is it the right strength on the vial? If we need it to be 1,000 milligrams for the dose, we want to make sure we're pulling the right vial. We're looking to make sure that it's not expired. If it's expired, that's not good. We need to make sure we're giving the right medication to the nurse, so when they scan the medication, they know that they are giving the right medicine. a lot of things we have to do as far as safety is there are a lot of things that look alike and sound alike. And you can get those things mixed up quite easily. And there have been actually medication events because something looked a lot alike, not necessarily within this facility, but they put in these safety mechanisms because something has come down nationwide that they're like, this could be a potential problem. So you need to be on the lookout. So you don't put, for instance, a calcium gluconate little vial looks a lot like a normal saline vial. Normal saline is something that is just the normal fluid, like a little bit of salt water, versus the calcium gluconate. That vial, if you give it too fast, that's something that we would use in a code situation. If somebody's heart isn't beating up, or if they have their potassium is too high in their system, it can cause their heart to go into what we call an arrhythmia. And we want to do something that's going to protect the heart. So we need to give calcium gluconate. You don't want to give that unless the patient needs it. So we put in these safety mechanisms for sorting to make sure, again, it's the right medication at the right time for the patient. Hopefully that answered your question.
Oh, yeah, I think so. And I'm confused by all the terminology myself right now. But I'm going to try and field to you another technical question here. So from Westlake High School in Austin, Texas, how do you choose between TNK-AC and Alteplase for a stroke? Did that make sense?
Yes. Well, they're both called TPA. They're tissue activator. And so TNKs versus Alteplase, they're basically the same thing, except one is a little bit easier to give. A lot of it has to do with cost. Tenecteplase is cheaper than Alteplase. It used to be that the FDA required that each hospital had to carry Alteplase on their formulary, and that requirement is no longer there. Versus Alteplase for a stroke, I can only give 90 milligrams, and so that's the total dose, but I have to give what is called a bolus dose over a minute, and then you give the remaining dose over an hour, where Tenecteplase, and there's monitoring that the nurses have to do with that drug. And if you're using Tenecteplase, you mix it and you have to use weight and things like that, and you give it what we would call as an IV push over a certain period of time. And so it's a much easier drug to administer over a quicker amount of time.
Okay, very good. Well, there are a lot sharper students down there in Austin, Texas than this guy right here. So thank you for taking that question, because I didn't understand it and you did a great job explaining it. And that's what we wanted for today, is to make sure that the experts explain the questions and the answers, and not this guy. Anyway, we do have a couple quick questions. Actually, one last question. Hickman High School wanted to know, what are some good classes to take for this career? Great question, Hickman.
Well, there's a lot of different I know that we talked about chemistry, but there's a lot of you need to have good communication skills and learning how to work with different professions. I work with speech pathology. I work with physicians. I work with nurses. I work with social work, but also you see patients that may not have the same communication that you have. And so you have to know how to meet people where they're at. So taking classes on like psychology is a class that's required. Sociology is a class that's required. Not only the math and sciences, but you have to be well-rounded to be in this profession. Otherwise, you're not going to have the same success that you might have just working in an office by yourself. We have to be able to communicate appropriately. If we have somebody who comes in who's maybe from a different country or has different cultural beliefs, we have to know how to meet them where they're at, to where if we're explaining something to them, that they actually understand it. Because if you misunderstand something, you could take something wrong and then actually bring yourself harm. And the same with the physicians. They have to know when I am recommending, I had a physician want to give a certain drug, what we call via an IV push. And this medication, you can't give it via an IV push. It could actually harm your vessel. You had to give it what we would call an IM injection, basically like the vaccine you get in the muscle. And so I was telling him that. And so I changed that order once I explained that to him. And to help, basically, we all have the same goal of keeping the patient safe and making sure we are helping one another out to be that barrier of safety to make sure the patient gets the appropriate treatment.
Yeah, that is the crucial part of your job, right? Making sure that the drugs that the patient is taking is helping them, not hurting them or putting them in detriment, causing them to decline their health. So, Janae, I wish we had more time. We have a ton of questions coming in, but we got to zoom on out to our next healthcare provider. We will follow up with you with some of those questions so you can answer them directly, and we'll get them back to the students.